I'm going to say something most men over 60 will never hear from their doctor: your penis might already be shrinking, and you may not even realize it until it's too late. Not tomorrow, not next year, it's happening now. Every week, men come to me whispering, embarrassed, asking if it's just in their head. It's not. And if you don't act, you're not just risking size, you're risking your health, your confidence, and your sex life. Tonight, I'm going to tell you exactly what to do before you go to bed, so you can stop the loss, restore what's possible, and protect the one part of your body that quietly predicts how long, and how well, you'll live. Here's the blunt truth: after 60, blood vessels start to stiffen, testosterone levels can dip, and the soft muscle tissue inside the penis is at risk of being replaced by scar tissue if it isn't used and nourished with oxygen-rich blood. That process, called fibrosis, is the main biological reason a penis can lose length and firmness over time. Add extra weight around the lower belly, and you get what's called a buried penis, where the base disappears under fat and skin, making you look even smaller. I've seen it hundreds of times in my clinic, and the sooner you address it, the better your outcome. There's another reality you need to understand: erectile changes often happen before heart problems. Why? Because the arteries feeding the penis are tiny, just 1 or 2 millimeters wide. If they start to clog from cholesterol buildup or inflammation, you'll notice performance changes long before you feel chest pain. On average, erectile issues show up 2 to 5 years before a heart attack in men with vascular disease. So when your penis changes, it's not just a bedroom issue, it's your body's early warning system for your heart and brain. I remember Harold, a 68-year-old retired engineer who came in convinced he'd lost an inch in 2 years. His belly had grown, and when he stood, most of the base was hidden. His blood pressure and cholesterol were both high. I put him on a plan: trim 2 inches off the waist, strengthen the pelvic floor muscles, and bring oxygen back into the tissue regularly. In just 3 months, his visible length returned, his rigidity improved, and, most importantly, his risk markers for heart disease dropped. His wife told me, he's walking taller, in more ways than one. So here's where you start, and yes, tonight. First, after dinner, take a 20 to 30 minute walk. It doesn't matter if it's slow, just make it consistent. This isn't just about fitness. Walking after eating improves blood sugar control, lowers inflammation, and conditions the arteries to open up. Men who follow a Mediterranean-style eating pattern, vegetables, whole grains, nuts, olive oil, fish, and fewer processed foods, consistently see better erectile health. Think of your penis as the canary in the coal mine of your cardiovascular system. Next, we have to train the pelvic floor muscles. These muscles sit under your pelvis, wrapping around the base of the penis and supporting the bladder and bowels. They also help trap blood in the penis during an erection. Weak pelvic floor muscles mean weaker erections. 3 times a day, do 10 slow contractions, like you're stopping your urine mid-flow, holding each for 5 seconds, followed by 10 fast squeezes. You should feel the base of your penis lift slightly and your testicles rise. No one can see you doing it, and you can do it sitting, standing, or lying down. If you've noticed fewer morning erections, or if you've had prostate surgery, you need to keep blood flowing into the penis to maintain tissue health. This is where something called penile rehabilitation comes in: daily low-dose medication like tadalafil, if safe for you, or a vacuum erection device used without the constriction ring, purely to bring in oxygenated blood for a few minutes. Think of it like stretching a muscle you don't want to tighten up. Even 3 to 5 short sessions a week can make a difference in preserving smooth muscle tissue. Some men's penises look shorter because they're literally being hidden under fat or excess skin. This is called a buried penis, and it's more common than you think. Weight loss of even 5 to 10% of your body weight can make a dramatic visual difference, and it improves every other measure of sexual function. If the issue is more severe, such as after major weight gain or surgery, there are medical procedures to uncover and secure the shaft, but for most men, diet, walking, and inflammation control work wonders. If your penis has started to curve, dent, or lose length suddenly, you may have Peyronie's disease, scar tissue forming inside the sheath of the erectile chambers. In its early stages, this can be treated with traction therapy devices that gently stretch the penis for several hours a day, sometimes combined with medication or injections. The earlier you catch it, the better the results. Left alone for years, the scar hardens and becomes much harder to treat. Let's talk hormones for a moment. Testosterone is important for libido and energy, but it's not a magic fix for every erection problem. You should only consider testosterone therapy if you have clear symptoms and at least 2 properly measured low levels in the morning. Even then, it works best when combined with lifestyle changes and vascular health improvements. If your arteries are clogged or your pelvic muscles are weak, testosterone alone won't fix the mechanics. Supplements like L-citrulline or L-arginine can help some men by boosting nitric oxide, the chemical that opens blood vessels, but they're not substitutes for the basics. And you have to be careful about interactions, especially if you're taking blood pressure medications or nitrates for chest pain. I tell my patients to treat supplements as an extra layer, not the foundation. Now, here's a story about Tomas, a 72-year-old gardener who came to me after avoiding intimacy for months. He had weaker erections, loss of length, and felt less like a man. We put together a nighttime routine, Mediterranean dinner, a 25-minute walk, a warm shower to relax pelvic muscles, pelvic floor exercises, and a short vacuum device session without a constriction ring to bring blood into the penis. We discovered he had undiagnosed sleep apnea, fixing that alone improved his morning erections. 3 months later, he told me, "I feel like my body woke up." His length had stabilized, his firmness improved, and his partner noticed the change immediately. There's also a list of medications worth reviewing with your doctor. Some older blood pressure drugs, certain antidepressants, and prostate medications can hurt erectile function. You should never stop them without guidance, but you can often switch to alternatives that protect both your heart and your sex life. Your vascular system is one big network. When we improve it for your penis, we improve it for your brain and heart too. Here's what I want you to do tonight. Before bed, check your waistline, measure at the navel. If it's more than 40 inches, commit to trimming 2 inches in the next few months. Do 1 set of pelvic floor contractions right now. If you've got the all clear from your doctor, do a short, gentle vacuum session for blood flow. Lay out your walking shoes for tomorrow morning or after dinner. And keep a small notebook by your bed, record whether you had a morning erection each day. That's a simple but powerful health tracker. If you've had prostate cancer treatment, you especially need a plan. Nerve healing takes time, and without regular oxygen delivery, scar tissue can set in fast. That's why penile rehabilitation is not a luxury, it's part of your recovery. If you're dealing with Peyronie's, traction therapy is the only non-surgical approach proven to add back length over time, but it takes patience and consistency. Avoid miracle enlargement gadgets or unregulated injections. I've treated men with permanent damage from them. So here's the bottom line, your penis is a barometer of your vascular health. If you protect it, you're protecting your whole body. If you ignore the signs, you're gambling with more than your sex life. I'm Dr. Samuel Boyd, and this is Senior Wellness Journey. If you found this eye-opening, subscribe to the channel and share it with another man who needs to hear it. Drop a comment with your age and the one change you're starting tonight. Because the truth is, your penis isn't just shrinking, it's speaking. Listen, act, and give it a reason to stay alive and well for many years to come.